This is Tanya Stansel, and we're going to be discussing asthma. First, a disclaimer. The purpose of this video is solely for educational purposes. It is not meant to diagnose or provide treatment. There are more than 25 million individuals in the United States diagnosed with asthma. 7 million of these individuals are children. Asthma is a chronic disease that affects the lungs, specifically the bronchial tubes. When triggered, the bronchial airways become inflamed, causing them to narrow, meaning not enough air is allowed into the lungs. Mucus may also be secreted into the airways, which further impairs airflow into the lungs. These two things occur due to what's called an airway hyperresponsiveness, which basically means that the bronchial tubes overreact to certain triggers. Triggers that can cause this overreaction are allergies, exercise, irritants such as chemicals or smoke, respiratory infections, medications, GERD or gastroesophageal reflux disease, cold air, sulfites, or preservatives. Signs and symptoms of asthma include shortness of breath, chest tightness, coughing, and wheezing. Individuals will have these symptoms in varying degrees. For some, the symptoms may be minor. For others, the symptoms may be very serious and may, in some cases, even be fatal. In 2013, 3,630 people in the United States died due to asthma. In 2015, the number of people who died was essentially the same at 3,615 deaths. Asthma is part of what is called the Allergic Triad, which also includes eczema and allergic rhinitis. Because chronic inflammation is the basis of all three of these conditions, having one of these conditions increases the chances of having the other two. Asthma is classified according to the severity of an individual's symptoms. Mild intermittent refers to mild symptoms up to 2 days per week and up to 2 nights per month. Mild persistent refers to symptoms more than 2 days per week, but no more than once per day. Moderate persistent refers to symptoms once a day and more than 1 night a week. Severe persistent refers to symptoms throughout most of the day and frequently at night. Some ways to know that your asthma is worsening are the signs and symptoms are occurring more frequently, breathing is becoming more difficult, or your relief inhalers are needed more often. Risk factors for asthma include having a blood relative with asthma, being overweight, smoking, being around secondhand smoke, and being exposed to pollution or chemicals. There are medications and treatments available for asthma. When an individual is having acute difficulty breathing, rescue medications are needed. Long-term medications are also used to control asthma symptoms. Rescue medications include short-acting beta agonists, which include bronchodilators, and ipratropium. Long-term medications include inhaled corticosteroids, leukotriene modifiers, long-acting beta agonists, theophylline, and oral or IV corticosteroids. Other treatments include writing an asthma action plan, which is based on what treatments are being used. It outlines which medications to take, when to take them, and when to increase or decrease the amount of medication. It also lists an individual's triggers and how to avoid them. Another treatment is bronchial thermoplasty, where the airways are heated with an electrode. This treatment is not used often and is usually done with severe asthma that generally has not improved with inhaled corticosteroids and long-term medication. Lifestyle changes can also be made, including using air conditioners, minimizing dust, dehumidifiers, preventing mold spores, decreasing pet dander, and cleaning regularly. In order to diagnose asthma, other conditions should be ruled out through a physical exam. Tests should also be done in order to check lung function, such as spirometry, peak flow, methacholine challenge, nitric oxide test, chest x-rays, allergy testing, and sputum eosinophils test. Thank you for joining our discussion on asthma. For more information on asthma and other health topics, visit our Healthy Living blog at healthylivingforyourself.blogspot.com and subscribe to our channel below.